Now, this week is World Immunization Week, and it's celebrated yearly to promote the life-saving power of immunization to protect people of all ages against vaccine-preventable diseases. We have joining us now from Yobe State, Northeast Nigeria, Dr. Hassan Saidu. He's a health specialist with UNICEF. We thank you very much for joining us. How are you seeing things playing out in Yobe State presently, especially in a bid to correcting the narratives and enhance immunization for all children there?
Okay, thank you for having me. I'm presently in Gashua, Bari local government to be precise, in Yobe State, and with the trend of what is happening across the state and as well across the country, what we're seeing is a renewed commitment by the government, the partners and communities, anchored on the platform of the strategic shift for the National Immunization Plus Days approach by the National Primary Health Care under the Federal Minister of Health. There is that new commitment where communities are being challenged to take the lead, especially most importantly, traditional leaders, civil societies and government agencies to collectively synergize efforts to ensure that every child is reached with important vaccine, most especially the polio vaccines, to prevent this debilitating disease condition in this area. So to summarize it, it's that there's a renewed commitment more than ever from what we've seen in the past.
Right, but how is the global funding crisis impacting on your agency's operations in Yobe and elsewhere?
Well, the global funding crisis is not something that was not anticipated. You know, I can tell you for 2 consecutive years now, we've seen a reduction in humanitarian assistance for especially humanitarian action. And so our agency has anticipated this, and we've been trying to re-strategize, and it was impactful. But however, we need the assistance of us collectively paying dear prices with lives of children.
Right. But what would be your advice for governments with limited resources, even as, you know, this reality of global funding, donor fatigue sets in? What would be your advice for governments to enhance immunization coverage?
Well, what we know is that, for example, vaccination, as we know, is one of the greatest humanity invention, and so there is no cost that go to waste in terms of enhancing life and preventing especially preventable deaths. So it's all about leveraging our resources, government prioritizing such interventions to enhance and optimize chances for children to survive, thrive, and develop, as well as individuals, adults, and adolescents. So it is about getting the priorities right, leveraging resources, and synergizing efforts of government partners and also civil societies.
Dr. Hassan Saidu, health specialist for UNICEF, thanks a lot for your contribution.